With increasing cases in the country, the government has in fact asked all the state and the UTs to ensure that they are in fact vigilant and alert. Now, as part of this, we are seeing that the Health Ministry has in fact asked all the state and UTs to ensure that they are conducting a 2-day mock drill. Now, April 10th and 11th has in fact been kept aside to do this mock drill across the country. Right now, I'm reporting from AIIMS Jhajjar. There are ventilators as well, which is in place over here. Now, the whole aim of this mock drill that is being conducted across the country is to in fact ensure that how well equipped our medical infrastructure and hospitals are, because in last 24 hours we have seen over 5,000 cases that has been reported of COVID-19, and apart from that there are 8 states that includes Kerala, Maharashtra, Karnataka, Delhi, where the positivity rate is over 10%, and that is of course a very concerning situation. But at the same time, we are seeing that though this subvariant that we are talking about, XBB.1.5, XBB.1.6.6, these are subvariants of Omicron which is doing the rounds. 60% of the samples that are being tested for COVID is in fact due to the XBB.1.1.6. But when we talk about this variant, it is though highly transmissible, but the symptoms are not severe. It is not leading to hospitalization. It is not really leading to mortality, and that is perhaps why we are seeing that the rules or the guidelines or the SOPs are not made mandatory at this point. Though Health Ministry has been asking all the state and UTs to ensure that the SOPs and guidelines are in fact implemented on ground on a very strict basis, on a strict manner, but these rules are not made mandatory. Now, as part of the mock drill, you can see today is the first day and we are at AIIMS Jhajjar. We can see how there are in fact a number of beds. The ICU beds are in fact in place. Remember, of course, the PSA plants is also something that is being looked into by the Health Ministry, because remember in the second wave, 2 things which were very, very concerning was how there was lack of oxygen cylinders and lack of oxygen supply in most of the hospitals, especially in the national capital. There are a number of hospitals that were out of beds and ICU beds, and that is why those have been the focus point that has been kept by the Health Ministry across the country this time as part of the mock drill. And remember, this is not the first mock drill. We have seen in this very year itself, since the beginning of 2023, this is the second mock drill that is being conducted. In January also a mock drill across the country was conducted, and this is going to be a usual practice is what the Health Ministry has been saying, with not just COVID-19, with influenza also doing the rounds. The government wants to ensure that the hospitals are well equipped to handle any sort of situation, any sort of infection, to contain the infection. These are the number of steps that has been in fact taken.